And calls are growing in India for tighter coronavirus restrictions to be reinstated days after the lockdown was eased. With more than 10,000 new cases reported, India is now the fourth worst-hit country in the world, overtaking the United Kingdom. The total number of infections is now close to 300,000. Nearly 400 deaths have also been recorded today, the highest daily increase.
Hospitals in New Delhi are under immense strain from the spike of COVID-19 infections. Half of the city's hospital beds dedicated to coronavirus patients are already full. Delhi's chief minister, who himself had a COVID-19 scare this week, says 80,000 beds will be needed by the end of July. It only has around 11,000 so far. The government is now considering taking over luxury hotels and sports stadiums to convert them to field hospitals. Cemeteries and crematoriums are also overwhelmed. While the official toll in New Delhi is just over 1,000, some say the actual number is twice as high.
जिस हिसाब से बॉडी आ रही है, उस हिसाब से मुझे लगता है कि अब जो जगह हमें दी गई है, वो जगह कम पड़ेगी.
Despite the surge in cases, the Indian government maintains there's no community transmission.
India is such a large country and the prevalence is so low that we have found that the prevalence is less than 1% in these small districts. In the urban areas it may be slightly higher, in the containment areas it may be slightly higher. But we are definitely, India is not in community transmission.
On Monday, India further loosened its lockdown to ease the impact on the economy. But health officials say the country is still weeks away from flattening its infection curve.
Neha Punia is in New Delhi and she joins us now for more on this. Neha, what are some of the restrictions that are being considered by various states?
Steve, we've been hearing this for many days now as India slowly but steadily inched closer to that psychological 10,000 mark which it breached today. Whether the lockdown was imposed too early when India only had 500 cases and whether the lifting of the lockdown was hasty as well at a time when cases seem to be steadily rising. There's been a lot of criticism leveled towards the government, but many state governments are now taking matters into their own hands. They're saying they're reconsidering, reimposing some of these restrictions. For example, the state of Punjab, which has now said that there will be a strict ban on the movement of people on weekends and public holidays. They're also going to be issuing an e-pass to limit the number of people that step outside their homes. The state of Tamil Nadu, which has the second biggest COVID-19 outbreak in India, is also looking at similar changes to its lockdown relaxations. The capital city of Chennai has a total of 70% of all of the state's cases, and the High Court has now asked the state government, why is it not possible to lock down the entire city? The state government says it's considering this, and a decision to that effect might be made in the days ahead as more and more regional governments are reconsidering imposing curfews to limit the movement of people. Jharkhand, which is a state which is ruled in part by the Congress party, which is in opposition, is also considering reimposing a complete lockdown. But what is interesting is that Delhi and Maharashtra, which are steadily seeing a big jump in cases, have said that lockdown restrictions will not be reimposed, that the lockdown will also not be extended, which is worrying according to many public health experts.
Neha, the healthcare system must be under a lot of strain because of this crisis. What is the government doing to address the huge gaps in ICU beds and other equipment?
Glenna, this is exactly the kind of situation that the lockdown was supposed to have helped India prepare for. A few weeks ago, we heard the Indian government say that the lockdown was used to utilize healthcare facilities, expand on things like beds, testing kits, etc. But now we're hearing from the Union government that 5 states are in danger of running out of ICU beds and ventilators between now and August. In fact, the government says its report has found that Delhi has already run out of ICU beds, something that we've heard many local hospitals as well as residents complain of, saying that it's impossible to get admission into a COVID-19 hospital. Similar projections being made for Maharashtra and Tamil Nadu as well, where the projection is that between July and in the first week of August, both of these states will run out of crucial medical equipments and healthcare facilities. And we're also hearing of a shortage of testing kits in many of these states. And the suggestion from the union government now to these state governments is that you've got to be more careful about how you're quarantining people. A lot of these states that have now seen air and rail travel restart have so far allowed people to self-isolate at home. The government says that simply is not the answer. We need to be monitoring people and their symptoms more closely. So it's proposing institutional quarantine for many of these states. It's also asking regional governments to take over stadiums and luxury hotels to convert them into COVID-19 treatment centers. But the question is that time is of the essence now. All of these regional governments and the central government need to move quickly in the days ahead.
Thanks for that, Neha Punya, on India's COVID-19 situation out of New Delhi.